Hello, my name is Debs Teasdale. I'm a women's and men's health physiotherapist and I work for Northumbria NHS Trust. I work as part of a fantastic team of specialist physiotherapists who work across the Trust, and we cover sites at Alnwick, Berwick, Wansbeck, Cramlington, North Tyneside and Hexham. Thank you for accessing this video. We have made 3 short videos to help support you during your pregnancy, and especially if you're experiencing pelvic girdle pain. Pelvic girdle pain can be experienced in the lower back, your hips, your pubic bone, your groin, your upper legs at the back or at the front, at any point during your pregnancy. In fact, 1 in 5 women can experience pelvic girdle pain during their pregnancy. This first video will cover the anatomy and changes during your pregnancy. The second will teach you some exercises that will enable you to keep strong and mobile. And the third will give you some top tips to help you during day-to-day activities.
Your spine has a natural S shape to it, a nice inward curve at the neck here, a nice outward curve at the middle part of your back, and then another inward curve at the lower part of your spine. Right attached to this lower part of your spine is your fused bone called your sacrum, and your coccyx bone is tucked right underneath at the end of that. At the sacrum here is attached your 2 pelvic bones, okay, and this makes up the sacroiliac joint here at the back. You also have another joint at the front of your pelvis called your pubic symphysis joint here, and 2 hip joints at the side are also tucked into your pelvis, which enable your weight bearing and your walking. You also have ribs which are attached to the mid part of your spine here. So although you've got lots of bones and lots of joints, you've also got lots of ligaments, tendons and muscles. You have a set of muscles tucked deep within your pelvis here called your pelvic floor muscles. You have muscles around the front of your tummy attached from your pubic bone up to your ribs here. And of course you have lots of muscles, tendons and ligaments attached here at the back. During your pregnancy, your anatomy and posture changes, and your body is amazing. It's designed to do this. As your baby grows, your centre of gravity changes, and this can cause an increased curve at the lower part of your spine. Your ribs change too as your baby grows and puts pressure on them. You also have hormonal changes which affect you in different ways during your pregnancy. The hormone relaxin enables the ligaments and tendons around your lower back and pelvis to relax and lengthen, to help you adapt to the postural changes and get you ready for the birth. Other changes you may have noticed are increased body weight, increased body temperature, increased oxygen demands, and of course that pressure on the bladder. Although these changes are all normal, you may be experiencing some discomfort around your pelvis or back. So what can we do to support you? Please see video 2 on gentle exercises to keep you strong and mobile during your pregnancy, and video 3 will give you some top tips to help you during your everyday activities.